is increasing pressure to have young athletes push through the pain, being driven by the desire to be the best at that sport.
There's definitely a lot of pressure on athletes of all kinds to go out and play through all little nagging injuries that happen throughout the season.
Athletes feel like they let people down a little bit and also like let themselves down.
It's something that's becoming more and more of a problem as we see athletes, both young and old, training more than ever.
They're not stressing their body in different ways, but they're doing very specific things over and over and over repetitively.
And injuries are becoming worse and worse.
That's an overuse injury. We can break down overuse injuries into two main categories: acute injuries or chronic injuries.
With an acute injury, a patient can usually identify the exact cause of what happened.
I heard a pop and I fell down and I was like, things hurt sometimes, but you can push through it. I just remember standing up and it's like my leg didn't work.
She tore her ACL as well as her meniscus. In order to be able to allow her safely to get back to playing a sport like lacrosse, we needed to go in surgically.
I had never dreamed of having an injury like that would have such a long recovery.
Chronic injuries are different in that it's usually an acute injury that hasn't healed.
I was dealing with a lot of dull pain through practice. Pain would be worse one day, feel a little better the next day, and then come right back. You know you want to be there for your team and you're just out there trying to play through it as best you can.
We knew that there were a number of things going on in his knee, and there were a couple of different things to address surgically, the goal of which is to give him pain relief that he hasn't been able to have otherwise.
I knew that I was going to be resilient through the process and be able to do everything with Dr. Gardner and with the staff that was going to get me back on the court.
Surgery is the first step in the process of the recovery, but there's still several steps that need to happen for that patient to heal effectively.
We're asking them to go back to foundational movements. And those type of activities tend to be more mentally taxing than actually physically taxing.
When you're going in there every day doing the same routine, and obviously you're going through a lot of physical rehab, but you're also going through a tough mental process.
I became really, really depressed after my surgery. I felt so lost.
Really coming to grips with that emotional and psychological side of the injury is very important. It's actually often that piece to it that drives the physical recovery.
Once their pain starts to subside, that's when they feel, okay, the clock is on, they have to get back into their sport right away.
As I always say, we can't outpace biology.
That's where we properly guide the rehabilitation process.
In the rehabilitation process, it's critical that we correct patients' movement strategies in order to reduce the risk of potential re-injury.
Being able to retrain and reprogram those movement patterns is one of the essential parts of what we call neuromuscular training programs.
This is really balance, coordination, what's called proprioception, which is knowing where your body is in space.
You learn a lot more of the technicalities of everyday living.
This really allows us to move away from these somewhat arbitrary guidelines for rehab that have things happening by dates on a calendar rather than the achievement of different milestones along the process. Data really is something that is becoming increasingly valuable, being different types of strength tests or functional tests that simulate the motions that might happen during sports, to be able to provide some objective feedback about where they are in the rehab process, especially for an athlete who is usually quite goal-driven. To give them numbers and data to work with can be very powerful to them.
When you come in every day and you're able to actually see on paper that you're improving, definitely helps with the mental side of things and makes the process a little bit easier.
We want to give them a new skill set to be able to go back to do what they want to do. We can't make them better, they make themselves better. Being able to see them do that is fantastic.
Colleen and Dr. Gardner treated me a lot more like an athlete and a person rather than just like an injury. I was working towards being confident again in myself and who I was, and also what I had the ability to do.
Where at one point it was something that I would think about for entire games. Now it's something that doesn't even come to mind when I'm playing, and I can play more free, and it's definitely a lot more fun that way.
I was just so excited to get back out there and just do the one thing that like I've been striving to do for so long.
As an athlete, for many of us, it remains a part of your identity really for the rest of your life. I was fortunate enough to have many people there helping me during my athletic career, and so to now be able to give that back to my patients, to be able to help them, is incredibly fulfilling.
Orthopedic surgery in general tends to be very reactionary, meaning somebody has an injury or trauma and we react to that and try to help them through that.
What's exciting is what we're now able to do to try to both prevent as well as treat injuries early so that they don't get to the point of needing to have a surgery. That's where things like the biologic treatments, stem cells and PRP, are very exciting in their ability to use and harness the body's own healing factors to be able to heal injuries that in the past we've treated by simply telling you to take off 6 or 8 weeks. It's very important to be able to make sure that we have not only the important biologic aspects of the injury in mind, but also the specifics of what the patient is looking for after their recovery to make sure that everybody's achieved their goals.